Hello everyone, today we are going to talk about something called the JN1 variant. You might have heard about it in the news or maybe from friends. It is a new type of the coronavirus, the virus that causes COVID-19. Think of it like a cousin in the big family of Omicron variants. Specifically, it is actually a sublineage of the Omicron BA 2.86 variant. This means it has evolved or changed a little bit from an earlier version of the virus. Understanding these changes helps us know how to best protect ourselves and our loved ones. So let us learn a bit more together in simple terms. It is always good to be informed, isn't it? This particular variant, JN1, was first noticed by scientists in August 2023. Since then, it has been watched very closely all around the world. What makes JN1 interesting to scientists, and important for us to know about, is that it has quite a few mutations. Mutations are just small changes in the virus's genetic material. For JN1, there are about 30 such changes when compared to its parent BA 2.86. These changes are not necessarily a cause for panic, but they are why health experts are paying attention and advising us on how to stay safe. Knowing its origin and nature is the first step. Many of these changes, or mutations, are found in what is called the spike protein of the virus. The spike protein is like a key that the virus uses to enter our body's cells. Because of these changes in its key, the JN1 variant has become better at spreading from one person to another. It also seems to be a bit cleverer at avoiding the protection our body has built up, either from past infections or from vaccinations. This characteristic is what scientists refer to as increased transmissibility and immune evasion capability. It means we need to be a little extra careful. Despite these characteristics, it is important to know what the experts are saying about the overall risk. The World Health Organization, or WHO, has looked at JN1 very carefully. They have said that the additional global public health risk posed by this variant is currently considered low. This is reassuring news for all of us. So while JN1 can spread quite quickly and has become quite common in many places, it does not necessarily mean it will make people much sicker than other variants, especially if they are generally healthy and vaccinated. We must remain aware but not overly anxious. So, as we have learned, the JN1 variant is quite good at spreading. Its mutations, especially those on the spike protein, make it highly transmissible. This means it can pass from person to person more easily than some older variants. It also has a knack for evading our immune responses. This means that even if you have had COVID-19 before, or if you have received your vaccinations, there is still a chance you could catch this variant. However, this does not mean that vaccines are not useful. They still provide very important protection, especially against severe illness, which is crucial. One important thing to remember is that while JN1 spreads rapidly, current information suggests it generally does not cause more severe illness compared to earlier strains of the Omicron family. This is a key point that health officials have been highlighting. Most people who get infected with JN1 experience symptoms similar to a common cold or flu. Of course, for some individuals, particularly those who are elderly or have other health conditions, any COVID-19 infection can be more serious. Therefore, taking precautions is always a sensible approach for everyone in the community. The JN1 variant has certainly made its presence felt in various parts of the world. It led to a noticeable rise in infections in several countries across Asia. For instance, places like Singapore, Hong Kong, and indeed India saw an increase in cases attributed to this variant. As of May 19, 2025, India reported 257 active COVID-19 cases, which was the highest number seen in about a year at that point. This shows how quickly a new variant can spread and why continued monitoring is so important for public health authorities across the globe. In Singapore, for example, weekly COVID-19 cases went up from around 11,100 in late April to about 14,200 in early May. This was quite a significant jump, about a 28% rise, and hospitalizations also increased by nearly 30%. Similarly, Hong Kong reported its highest weekly death toll in a year with 31 fatalities and over 1,000 new infections. However, it is important to note that even with these increases, authorities in India have stated that most infections are mild, and the overall situation is considered to be under control. It is always very useful to know the common symptoms if you think you might have COVID-19, especially with new variants like JN1 circulating. Being aware of these signs can help you take action quickly, like getting tested or seeking medical advice, which is good for you and for others around you. Some of the most frequently reported symptoms associated with the JN1 variant include having a fever. You might feel hotter than usual, or you could have chills. Another very common symptom is a cough, which is often a dry cough for many people. Beyond fever and cough, there are other signs to watch out for. Many people infected with JN1 experience a runny nose or a blocked nose, much like a common cold. A sore throat is also quite common, making it uncomfortable to swallow. Headaches can also be a feature of this variant, sometimes mild and sometimes more persistent. Feeling very tired or experiencing fatigue and exhaustion, even when you have not done much physical activity, is another symptom that people have reported. These symptoms can appear in various combinations and intensities. Interestingly, with the JN1 variant, some people might also experience a loss of taste or smell. This was a well-known symptom with earlier COVID-19 variants, and it can still occur with JN1, though perhaps not as frequently as before for some individuals. What seems to be noted more often with this variant by some reports are gastrointestinal issues. This means problems related to your stomach and digestion, such as experiencing diarrhea. Some people might also feel nauseous or even vomit. So tummy troubles could also be a sign. If you start to experience any of these symptoms, be it fever, cough, sore throat, headache, tiredness, runny nose, loss of taste or smell, or any tummy issues like diarrhea, it is important not to ignore them. Even if the symptoms seem mild, it is always best to be cautious. Consider if you might have been exposed to the virus. The most sensible thing to do is to monitor your health closely, and if you're concerned or if your symptoms get worse, you should seek medical advice from your doctor or local health clinic for proper diagnosis and care. The good news is that there are many simple and practical things we can all do to help protect ourselves and our loved ones from the JN1 variant, and indeed from other viruses too. One of the most effective ways to protect yourself, especially against severe illness, is by staying up to date with your COVID-19 vaccinations. This includes getting any recommended booster shots. Vaccines, including the updated XBB 1.5 boosters, are designed to help our bodies build strong protection. They remain very effective in bolstering immunity at a population level against symptomatic and severe disease. Next, let's not forget the power of good old-fashioned hygiene. Maintaining good personal hygiene is a cornerstone of preventing infections. This means washing your hands regularly and thoroughly with soap and water for at least 20 seconds. If soap and water are not readily available, then using an alcohol-based hand sanitizer is a good alternative. Try to avoid touching your face, especially your eyes, nose and mouth, with unwashed hands, as this is a common way for viruses to enter our bodies. These simple habits can make a big difference. Wearing a mask is another very helpful measure, particularly when you are in crowded indoor public spaces, enclosed areas with poor ventilation, or on public transport. Masks act as a barrier, helping to prevent virus particles from spreading when someone coughs, sneezes or talks, and also reducing your own exposure. Practicing social distancing, which means keeping a safe distance from others where feasible, can also reduce the risk of transmission. While life has returned to normal in many ways, being mindful in certain situations is still a good idea. Finally, remember to monitor your health regularly. If you do start to feel unwell or notice any symptoms, it is important to seek medical advice, diagnosis and treatment promptly. If you are planning to travel, exercise caution and make sure to follow any local health guidelines and advisories. And don't underestimate the power of a healthy lifestyle. Consuming a balanced, home-cooked diet rich in fruits and vegetables can help support and boost your immune system, making you stronger. By taking these sensible precautions, we can all contribute to a healthier community. Stay safe and take care.